Medidenta. Suitable endodontics.
In this video, we are going to discuss the low engagement instrumentation technique, focusing curved and narrow canals, like mesial canals of lower molars and buccal canals of upper molars. We recommend to see the LET fundamentals video before seeing this segment. Let's take a look.
The principle of the low engagement technique is to use instruments with different tapers but with the same tip diameter. The goal is to achieve enlargement without forcing the weakest part of the instrument, which is its last millimeters. One of the features that we want in instrumentation is precisely the smooth increase of the diameter of the canal in sequence, without forcing the instrument during the cutting and enlargement. Ideally is to keep the last millimeters of the instrument as little engaged as possible, leading to a smooth cut with a final area. The goal is to keep a range of 20 to 30% of the initial diameter. The technique will be demonstrated with the Medidenta's Mfile Gold instruments. These files are composed of a USA Fort Wayne's nickel titanium alloy, with a rhomboid triangular cross-section. The proprietary heat treatment performed leaves the instrument with extra flexibility, predominantly in the martensitic phase. The Mfile Gold recommended rotation is at 300 revolutions per minute, and torque of 1.5 to 3 newtons per centimeter. The instruments must be sterilized before use, and are for single use only. Mfile Gold instruments are offered in diameters from 15 to 60 in taper 04, and 15 to 50 in taper 06. The color of the Mfile Gold rubber stop indicates the taper. The green is 04. The red is 06. To demonstrate the LET technique, it was developed a training block printed on a high-definition 3D printer. After a laborious job of detecting the mandibular molar morphology through micro-CT, it was possible to reproduce in one model the three most frequent types of root canal morphology. In this segment, it will be demonstrated step-by-step instrumentation of curved and narrow canals. Before starting the instrumentation sequence itself, some important procedures must be performed. It is always good to remember that rubber dam absolute isolation is mandatory in endodontics. First, we will clean the pulp chamber and prepare the canal's entrance, using a diamond-shaped conical ultrasonic tip, with constant irrigation, gently touching the preparation sidewalls. With the pulp chamber clean and the canal entrances prepared, we will add a lubricant that contains hydrogen peroxide, to facilitate the canal scouting and help with disinfection. Then we'll pour sodium hypochlorite to start cleaning, disinfecting, and removing organic tissue from the cervical and middle thirds. Note the champagne effect of the chemical reaction between the RC prime lubricant and sodium hypochlorite. The lower molar endo training block has 3 canals. We will demonstrate the instrumentation sequence on the narrow and double curve mesiobuccal canal. This canal has a curvature from mesial to distal, and another curvature from buccal to lingual. Note also that the diameter in the last 3 apical millimeters is 0.12 millimeters, being quite narrow. To scout the canals, use a K-file of small diameter freely in an up and down movement. With a pulp chamber full of irrigating solution, we will proceed to pre-flaring, that is, enlargement of the cervical and medium thirds with an Mfile Gold 2506 rotary file to the limit of the curvature. Use the brushing movement against the side walls. Do not remain more than 10 seconds with the instrument active inside the canal. After instrumentation, proceed with copious irrigation. After pre-flaring, use copious irrigation and, with a K-file, determine the working length. Place the file inside the canal and advance to the temporary working length. With the instrument in position, turn on the apex locator, connect the lip clip and file connector, and gently advance apically with oscillatory movements until the apex locator points to position 0. Remove the file connector and proceed with a smooth enlargement with the file in position, using oscillatory movements. This type of curve and narrow canal needs an additional preliminary step, which is the creation of the glide path. This procedure consists of using a 1504 file up to the working length. After the 15.04, proceed with a copious irrigation. Use the same K-file at the cleaning working length to maintain patency. Repeat irrigation and use the Mfile Gold 2004 up to the working length. Do not remain more than 10 seconds with the instrument active inside the canal. Always repeat the irrigation and patency after each file use, or any time during instrumentation. The next instrument in the sequence is the Mfile Gold 2504. This instrument must be used up to the working length. Do not force or use pecking movements. Copious irrigation and patency with the K-file 15 should always be performed after using the rotary instrument. The next instrument in the sequence is the same Mfile Gold 2506, used before in the pre-flaring phase, but now it must be used up to the working length. Copious irrigation and patency with the K-file 15 should always be performed after using the rotary instrument. Optionally, you can finish the preparation with a 3504 instrument. This final enlargement results, according to studies, in a more efficient cleaning, increasing the space for the irrigation action and a better obturation adaptation. Finalize your preparation with copious irrigation and patency. The low engagement technique described results in a space suitable for safe gutta percha master cone insertion until the working length. Thanks for joining us in this video. For more information, go to www.medidenta.com.
Medidenta. Suitable endodontics.